Good evening, everyone, and welcome to this SciFest Africa webinar. I'm Tony Lancaster, and I'm going to be hosting this session for everyone. This session called From Lab to Life, How Science Innovation Can Save Lives. Just a couple of housekeeping notes at the beginning. If you want to ask questions of Tanya at the end of the webinar, please use the Q&A function here within Zoom. Just click on the button at the bottom of your screen, type in your question, and we'll get to as many as we can after the webinar. Alternatively, if you'd like to ask your questions on camera and engage a little bit, that's welcome as well. Just use the raise hands function, raise your hand, and then we can call on you as well. But that discussion will take place at the end of the webinar. So, on to business. 2021 UNESCO report said that there are about 8.8 million scientists working globally, and spend on science in that year had grown by about 16% in the 4 years prior. Most of that growth was driven by spend in the US and China, which raises all sorts of questions about the extent to which investment in science is considered a priority, a spending priority in the developing world. But there are a lot of resources, one way or the other, being deployed globally to tackle questions big and small. But how much research makes its way out of the lab into our day-to-day lives? It's true that the onset of COVID-19 has put the spotlight on research and vaccine development. And it's probably true to say that in our history, there's never been a time where your average non-scientific person has had such a great interest in the work of those wearing white coats in laboratories. And never has their expertise and innovative flair been more critical for the survival of the planet. But there's a lot more to science than COVID research, and there's a lot of art, instinct, and innovation that comes to bear on the process of developing life-changing breakthroughs and bringing them to market. Tanya Akoni's career has focused on helping international public and private sector organizations understand how to amplify their impact through the convergence of people and innovation. At the heart of her work is a desire to use innovation to drive social impact and public good. She's been at the forefront of advocating for and leading groundbreaking initiatives at the United Nations Children's Fund, or UNICEF. Her work at the Global Innovation Center supports more than 120 countries to identify, adopt, and adapt innovative solutions that have changed the lives of 280 million children and their communities. Tanya is a Fulbright Fellow with multiple graduate degrees, including in Studies of the Future, and she's also a Rhodes University graduate. She's the fourth generation of her Chinese family to be born in South Africa, where she spent her childhood on the outskirts of Tshwane. She joins us now from New York. Welcome, Tanya. We're delighted to have you. And I'm going to hand over to you now to hear what you have to share.
Thank you so much, Tony, and delighted to be with everyone, and a wonderful opportunity. Love these conversations that SciFest Africa pulls together to really look at the kinds of context, ideas, creativity, and go-to-market kind of questions that scientists across the continent have. So thank you for the opportunity to sort of share some of our areas of interest. And I, as was advertised, I'm going to take you on a sort of a walking tour, if you will, through a journey of what does it take to go from lab to life, because it's not an easy journey. Science innovation can speed from lab to life, but often the speed that we experience this as is actually takes a lot longer. And you have to actually hopefully walk away from today's seminar with a little bit more empathy for your fellow scientists, or for scientists and others who work in research and development, because what may seem like incredibly fast progress actually has years and years of work behind it. So today we're going to focus on a couple of essential ingredients that I've come to appreciate is the difference between whether something will win as an innovation in terms of making its way out of a lab, out of somebody's PhD thesis, and actually enter any of our lives, and beyond making itself a commercial sort of success, whether it will actually make a social difference. And that is the really key question that hopefully you'll see and sort of play out in the various examples that we'll go through together, because really science can not only publish a lot of new knowledge, it can actually save lives, it can create new industries, and it can also empower just transitions of society. But it actually has to take some of those things as a fundamental decision, and as something that it puts in terms of its vision for getting out of the lab and into our lives. So what are some of these kind of essential ingredients? Decided to kind of pull these together into a short list of 5. What are 5 things that might get us to the win? And what does that win look like? That win is science that saves lives, science that also has a social conscience, science that makes a difference outside of the confines of a lab. These 5 elements are really around the what. What are these kinds of expected and, in fact, many unexpected ideas that come out of research? And what are some of the constraints to exploration? We'll talk a little bit about the things that are holding science back as well. There's also the will. What's the intention? What's the vision? Is it really about trying to commercialize something? Is there a piece of that intention that relates to a social good? And it's an especially important question for developing countries to ask themselves. There's also how, the way. How does the infrastructure assist this? Does it even exist? What are the incentives or often disincentives to making this journey? And how could we work on processes to actually really do more helping than hindering in science's journey from the lab to actual impact? And then there's the piece I spoke about in the beginning, which is this speedy process is a little bit longer than you might expect. And I hope to surprise you with a few examples of things that you know well, that you've seen in your everyday life that probably take a lot longer to get to you than you thought it did. And finally, there's the want or the passion. And that's really what defines the success of anything that takes this journey. Is it about profit? Is it about people, the planet? Is there anything about a just transition that makes sense? Or is it just, what is that vision that really defines the win for anything that moves out of a lab? So as Tony mentioned, I am based in New York, and I'm based actually just 2 blocks from Pfizer's global headquarters. This is the campaign that they have had up outside their building for the last sort of year and a half. And I think it really does a lot to talk about the aspirations, the greatest aspirations that some science can have. Is really positive. It talks about how science can really attack and cure any disease, and that it wants to win more than any disease wants to exist. It's about the relentlessness, and I think it's a very interesting positioning of an organization completely focused on getting science out of the lab and to commercialize it. And so part of my question here in looking at some of the examples of Pfizer's work, which is an organization that has many things lined up to get things out of the lab and into our lives, is to what degree does getting it beyond our pocketbooks play into this? Let's take one example. About 15 years ago, if you had said Pfizer to anybody, that name recognition would probably have come with thinking about this. And if we were sitting around the table together, I would ask you to sort of say, do you know what this actually is? But as we're a little bit more remote, I'll tell you what it is, but I'm sure you've guessed. All those years ago, people would have had a one-to-one relationship of Pfizer as being the producer of Viagra, the little blue pill. What you might not know is that this was a complete accident. Originally, Viagra was not an erectile dysfunction solution, but it was actually a research that was being used to develop something that would help with blood flow to the heart, so people who had cardiac issues. And it was only as they were testing this on in human trials that they started to notice some unusual things. And while keeping this in a family-friendly format, I'll just share that a number of the people who were doing the observations of the people who were coming in to test the drug realized that something odd was happening. When they came in to do sort of check on the patients, the men were no longer lying down, they were lying on their stomachs. And that was because, of course, as you know, this was actually more effective at increasing blood flow to a different organ in the body, not the heart. So often science can lead us to unusual findings, places that we didn't think we were heading to in this case. But this had turned out, until its patent expired, to be a $500 million revenue stream for Pfizer. And until, of course, the sort of last 2 years, that was one of the things that they were most known for. As Tony mentioned, though, science has touched everybody in the world very much with the COVID-19 pandemic. And we have experienced the sort of sensation that especially the kinds of vaccines that have come from Moderna and Pfizer BioNTech is seemingly at a miraculous and breathtaking rate of speed. But that is actually not the case. because the work on the mRNA process through which these two vaccines are delivered actually began back in the 1990s. The first human trials were done, the first human trials were done in 2013. And initially there was work to develop an Ebola, it was work on Ebola, but to the question, why did that not go further, was really that was not sort of seen as very large in terms of a market and therefore not really commercializable. And so that technology had been developed and tested for a while until, unfortunately, the current situation with COVID-19 provided a massive global demand for solutions. And that is one that millions of people around the world have been safely jabbed with. Again, so many of the concerns that some people had in terms of being hesitant about these two vaccines really turn out to be unfounded, because there's, as I say, their seemingly breathtaking speed was not so breathtaking. And that's one of the things that we need to realize is the journey of taking science out of the lab and into our lives is actually truly quite a long one. And now we get to taking things out of commercialization and profit and turning to what may be the public good. Those of you in South Africa may recall, in the 1980s and 90s, when the country was being, and the continent and much of the world was being ravaged by the HIV epidemic. A number of countries stood up and demanded that patents would be lifted on antiretroviral care. And it is that same kind of inspiration that is now driving the pressure to waive the patent protection on COVID vaccines. And that's really where the difference starts to come in. You can imagine research and development for all those years takes a lot of money and investment. And in the sense of commercial R&D labs, they're looking to recoup that. And so here, though, we have a real question about whether for the world it is fair to continue to drive only profits, or whether people and indeed our planet need to have more care and thought for a very different business model. And really that's a key question, is around how you start with a different sense of vision of what success looks like and what your intentionality is. So let's take a step very close to home and talk a little bit about next generation diagnostics, because not far from the home of SciFest Africa lies Rhodes University's Biotechnology Innovation Center. And that is a center that actually takes the social impact of its work and of its research very much to heart. So its role is really looking at how science can move and come up with new inventions, new novel solutions that can address things like the massive numbers of women and newborns who die every year because simply they don't know that that they may have a condition that would require them to be in a situation where they give birth with some assistance. And so this led us, and I should caveat here that UNICEF has been working with the Biotech Innovation Center at Rhodes over some years to explore how to take their groundbreaking research that has a social heart to a market where we can ensure together that this type of, in this case, a smart pregnancy test can actually help identify sort of conditions that could prevent this 14% of maternal deaths that are caused by things like by having multiple babies and not actually knowing that that is the situation. So we all know pregnancy tests, or do we? There's a big assumption about whether they're available, whether they're accessible, or whether they're affordable. And having looked at that specifically with this project, I can tell you they are none of those things. So something that is actually science in many people's lives, that in some parts of the world, people don't really think of sort of spending $2.70 on buying a pregnancy test. That's an unaffordable amount of money for many millions of women around the world. So what can science do about this? Well, at Rhodes University's lab, and this is actually the lab or part of it, and some of the researchers who are working on this work, they've designed a completely groundbreaking new kind of biorecognition agent. And applied to this particular problem, it provides a result that tells you not only am I pregnant or not, but how long along is my pregnancy? Is there some condition that can be flagged that can tell me if I'm a woman living very far away from any health clinic that might cost a lot of money, time, or walking effort to get to additional healthcare that I actually need it, and I can get there in time so that we literally can save lives. But it is still quite a long journey. You have to have the will to take it, of going from the time of actually doing the academic publication of this work to being able to take it out to millions of women throughout the world, in particular, having the patience and persistence to manage the complex intellectual property and business modeling that's required when you want to look just beyond making a profit, which this has as a project at its very heart. But it does, take the will to last through the number of years that it will take before you will be able to be seeing the results of this as an actual product in the hands of women who live very far away from any urban area. Let's switch completely differently to another example. And let's take a look at unmanned aerial vehicles, or drones. You've seen them. You've probably not seen this one, though, which is really where the whole idea of unpiloted drones really originated from. In most of our imagination or experience, drones have been the thing of science fiction. They've been the thing of action movies. They've sort of seemed to have, again, come out of almost nowhere. But in fact, it took a very long time for drones to come out of this, one of the first unpiloted, remote-controlled, full-size drones. In fact, 105 years. Because that photo was taken in 1917 of a vehicle called the Aerial Target. And it was the first drone to fly under remote control and be able to undertake a number of functions, designed by a researcher called Dr. Archibald Lowe. Not surprisingly, though, many of the use cases are the ones that you're quite familiar with. Surveillance, its use in defense, which is a use that we're seeing in our daily headlines these past few weeks. But drones, again, it's as a piece of research and development, are a tool and a platform that don't necessarily need to be used only for some of the sort of perhaps non-social purposes that we typically think of. When we ask ourselves about what is the will and underlying intention of applying and bringing an innovation or a piece of science into our life, those applications can vary as wildly as the intentions and will of the researchers and those who really take the research to apply it and build it out. It also takes us into asking how patient you can be. A lot of work that we at UNICEF actually do in the area of drones is around asking where they can deliver, literally sometimes, social good. And there are many different types of applications in the world that are really hold people and the planet at its heart. And not only that, but look for how a new industry, which this has become, can really be part of a just transition. What you're looking at right now are just a few examples of the sorts of work that we've done in terms of actually taking this science and applying it to a completely different purpose. On the right is an image that comes from Malawi, where we are using drones and testing them to actually deliver life-saving vaccines. We've also used that same technology in the Fijian Islands, where the distance between islands is incredibly vast and where it is incredibly expensive to have to either helicopter in materials or take them by boat. And so drones really can literally deliver not only Amazon packages, but life-saving supplies to people for their ordinary sort of health purposes when they're in very remote areas, or in fact, of course, during emergencies as well. And during emergencies, there's also another opportunity to use drones for a completely different application. So if you look at the reverse side of sort of surveillance on people, the kind of people positive application is really what we use in flooding situations where there's been a natural disaster. So as an audience who has Africa very much on its mind, you'll recall earlier this year, there were immense floods in Mozambique. And that is an example of many that we've applied over a number of years of using drones to very quickly be able to access, assess, and sort of see the nature and extent and damage that is caused by something like intense and sudden floods, to understand whether and how we can get to support people, what sorts of things can be delivered and how, which are things before that might have taken days and a lot of actual physical movement. So again, another completely different humanitarian application of drones. But as an entire industry itself, there is also another social heart to this when you're not looking purely at a profit margin. And in the top left, you'll see this photograph, which is taken in Malawi at the African Drone and Data Academy. And here we're actually equipping young people to be the winners, to be part of the transition that is just to launching and participating in as entrepreneurs, as service providers in the sort of drone or UAV industry. So this academy, young people learn to not only fly and operate drones, they learn how to build them, how to repair them and maintain them. The data component is also how to secure and use sort of drones to acquire data, whether that is, for example, flying over an area and being able to assess and gather information. That could be things about agricultural crops, that could be around the amount of kind of water. They could be, you know, as explained earlier, around a whole area where there is an emergency or where there is a really difficulty in accessing this. And the bottom left is an example from Namibia, where they are also launching a whole process of using drones to get to very remote places. A large country with barely over 1 million people, many of which who don't live in the main urban areas, are quite spread out. And so again, another more cost-effective and effective sometimes way of accessing people who might have been largely inaccessible before. So what happens when you take science, research, development, commercialization, but then you take it out and sort of put a whole social public good at the center? And that's the question really that I have around 3D printing. How long did it take to get here? What was the sort of piece of research? It took a very long time. In the public imagination, probably in all of our imagination, maybe the first time you were really aware of 3D printing was really a lot more recent than 41 years ago. But this really shows the first machine invented in 1988, yes, in a research and development lab by Dr. Kodama, who first described the process of 3D printing or manufacturing something by sort of putting simply one layer of a substance on top of another that could be joined together. And it's taken a very long time and a lot of fits and starts to go from this sort of rather interesting but still familiar looking setup to the sorts of things that we sort of see today. Toys for children, serious manufacturing of different sort of components, the 3D printing of entire cars, of key components and sort of plumbing. There's a lot of 3D printing that happens in everyday life, including the 3D printing of internal organs. And this, the thing that you see here is actually a 3D printed kidney. And there are lots of advantages to the precision of being able to 3D print something. And that's really sort of remarkable. So in terms of 3D printing, the sky's the limit in terms of what the will is around the underlying intention and how this technology that has emerged from, a piece of basic research that essentially posited the possibility of manufacturing things one layer at a time into actually a whole range of use cases and applications that touch our lives. You may well be watching this sitting on a chair that has a 3D component that is holding it together. And there's a lot of incentives that are helping this particular technology scale up and be applied to just so many things. Those relate to kind of cost, to being able to produce things and not have to transport them, to really dislocate our entire idea of what a supply chain looks like, even though that was not the original intention of the first pieces of research that were done on this. They were really driven by a lot of things that science is driven by, and that is really curiosity and extending the basic kind of scientific knowledge about the world. And when you pair that into actual application, that's when sometimes magic really happens. So some of the questions we're asking ourselves and some of the things, the exciting ideas we're seeing about the application of 3D printing to sort of social purposes are popping up on this page. The bottom right is a 3D printed bionic arm that is created by a group of teenagers in Kosovo. And this bionic arm is for use by people who have limb amputations, in this case, obviously their arms. But these young people took the technology, designed their own 3D printed arm, and in fact, it is 90 times cheaper than any other similar limb on the market. So give young people the capability and skills to do things, and they will really amaze you with what they can achieve. And that's really one of the things in terms of UNICEF's work that we really believe in. That young people are and have a superpower, but we just need to equip them with the right opportunities and access to unleash that. The picture of what looks like super futuristic housing is actually not futuristic. It's kind of from a few years ago. And these are the first 3D printed houses that exist in the Netherlands. And when we look at this, we ask ourselves, you know, if you put sort of people and demands at the heart of it, how might we use this kind of technology to do things like 3D print clinics in places where they're not, or 3D print houses for places where you have a sudden onrush of housing for refugees, for example. And how would you actually do that, really, if you had to get this type of technology to places where, you know, we don't think about pristine lab-like or, you know, commercial production facilities? What does that innovation look like? What does that taking it out of a lab and out of a commercial process and into, you know, all kinds of different rugged locations? And people are thinking about that. At the bottom left, you can see one example from Milbot, which has completely containerized a large size 3D printer so that it can be taken and solar charged, and it can actually also reuse certain plastics. So again, the opportunity of putting the planet at the heart of this in terms of a circular economy is pretty interesting. And then I'll just touch on 3 other examples very, very quickly, which, you know, is really more maybe prompting some questions and some thoughts from all of you. In the science, if you will, of learning from nature, there's quite a lot of work going on around biomimicry. And what we're discovering in many areas is that nature does it best, and whatever that natural lab has been far exceeds some of the solutions that we ourselves can dream up with our human limitations. One of the pieces of work, which in fact is occurring in South Africa in very early ideation stage and in other parts of the world as well, is looking at the Manta Ray and looking at how its filtration system is actually one of the most superior designs that exist today, because most filters that are created elsewhere through other types of technologies or approaches actually clog over time. But a Manta Ray's filtration system is built entirely differently and does not clog. It doesn't need cleaning, it reduces maintenance, and putting the planet on top of this and people as well. This is the kind of technology that if we take it out of the lab and take it out of the scientific research that is currently informing and sort of exploring how these actually work and how they might be copied on a larger scale, we could really have a solution that starts to look at wastewater treatment, that could be applied to a challenge like the microplastics pollution that is really everywhere, including in all of us right here, those of us on this, and everyone who's watching the live stream. We all have microplastics in our bodies, and they're exceptionally difficult to filter out. But now we know that actually, if we built a filter based on the Manta Ray's gills, that is actually very effective at filtering them out, and it doesn't come at the filtration cost of any other solution that we have today. But this is still in the realm of science. This is still science in the lab. So the question is, what's the will, what's the way? Do we have the patience to wait and the want to apply this beyond sort of commercial applications that you could imagine in industry and in mining and other kind of extractive industries, to bring this into our lives in very sort of social positive ways? And that's the same question with artificial intelligence, something which has actually evolved over a long period of time. Still very much the ideas of science fiction as well. But again, a technology that can and has been applied in so many different ways, and a kind of technology that started as pieces of research, specifically in mathematics, building the formula and the algorithms that have evolved today to become an entire massive industry sector of data science. How are we applying this? How will we? What is the potential for applying algorithms in an equitable way that doesn't result in sort of missing out half the world in its assumptions? How do we think about keeping people and planet and equity at the heart of how artificial intelligence evolves? And it is evolving extremely fast, and it is evolving in a way that's not very equitable at the moment. And you will have all probably read a number of stories that are almost constantly in the news about students who received crazy results as a result of an algorithm that either included them or most typically excluded them. All sorts of pieces of information about the data being used to train artificial intelligence and machine learning, which I'm sorry to say misses out most of our continent of Africa. And therefore, when you make decisions where parts of the world don't exist, you're not going to get out of it the best sort of, or at least you will not get a fully informed picture. So what more can we be doing in science and in its application to really leverage and achieve incredible outcomes that are good outcomes for all of us and for social good from something like artificial intelligence? And it's sort of, when you pair it together with the kinds of insights that you can get from near real-time remote sensing, satellites, drone imagery, and the triangulation that artificial intelligence can bring down to crunching massive amounts of information and seeing patterns in this, including all kinds of modern data sources like from mobile data. But what does it look like if you take some of that and apply it to the sorts of vision and intention where you have social opportunities to really change and save lives? This image captures one of the projects that we're involved in, which is looking at how to manage Africa and other parts of the world's water resources more effectively. And that's when you combine machine learning, you combine kind of image processing via computer, you combine remote sensing, and you combine all kinds of sensors into a near real-time way of making sure that we don't destroy fossil water, that we manage our water more effectively, and that when we do drill boreholes, for example, they can be more than almost twice as effective and cost-effective and accurate than any other mechanism that exists for identifying that today. That's a kind of life-saving, literally, sort of solution that this year is going to benefit 4.5 million children. And that's what can happen if you have people, the planet, at the heart as much as other commercial interests. And that really is, though, the thing that takes us to some of the incentives and disincentives and why do things get stuck in the lab. I know from taking a peek through some of our participants that we have some real leading scientists on this call. And I think that they will recognize some of these challenges where, funding is a real challenge, and the need to continue to publish is a challenge. It's a challenge to being able to move things translate it and apply your research. There's also a competition for funding because it is limited. And often that can emphasize safe, predictable outcomes, because funding doesn't often allow us to make those crazy sort of discoveries where you're going for, where we started, a drug that helps with cardiac blood flow and ends up somewhere completely different. And there's sometimes conflicts of interest in terms of where you can get funding. Is there a conflict of interest when a food company funds nutrition research? Will that influence the research questions? These are all sorts of complex things that influence science and influence the ability for scientists and researchers in terms of just the ability, the freedom to explore the world of knowledge and its application. But CRISPR is a great example. So CRISPR is the gene editing technology that literally is sort of taken genetic editing out of the lab and almost into everyone's, garage or, a sort of parking space, on how basic research was made into something that was applicable and accessible, to even an amateur sort of scientist, which in itself might be a frightening idea of what happens when you make science truly accessible, and will you always end up with the results that you would have liked. But it is, in fact, a technology and something that has come out of the lab at a truly rapid rate. It isn't 40, 50 years of work. It really had moved at the rapidity that we all observed in the media coverage of it. And what are the sorts of things that we can actually do to liberate science from some of the shackles that hold it back to being even bigger and more impactful on all of our lives? These are sort of three of the biggest ones. Technology transfer being the term we use of like being able to take something from a piece of basic science research that's applied and get it out of the lab literally into an environment that's supported and funded and can actually then live, breathe, grow, and take actual shape and be commercialized, be productized, be available. And part of that is also a larger infrastructure around intellectual property, around whether that expertise is affordable, accessible, and even is aware of and can support solutions to be open sourced, to be developed and protected as public goods, to be able to be managed with a different sort of revenue model that makes things much more available and accessible as social goods first. And then finally, whether the environment in which all of this lands actually has incentives and access to investment to help things grow and really come to life. So bringing it back to where we almost started, a lot of the success of taking science out the lab depends on these things. There are unexpected ideas, but if your scientific funding encourages you to rigorously not stray, are we missing out on those ideas? The kind of unexpected wins. What's the underlying intention? Is it to get a product? Is it to take science to get to a product that will be commercialized? Is it a pure exploration of curiosity and basic research? And also, do we sort of fool ourselves into a false sense of basic research and applied research really being so different? And do we actually have those infrastructural things in place? Have we the way to hurdle some of these things that are hindering this process? And does the patience and persistence and grit exists in the people who are there to sustain the long journey, often more times than not, to go from a piece of research and a paper into something that is in all of our lives or bodies? Does the financing exist to support that journey? And then really, what's your vision? How much does financial success play up against other kinds of things? Is there even room in your vision for something that is spawning an entirely new product or even an entirely new industry, to ask yourself, in this entire explosion of going from the lab to real life, can this be done in a way that also empowers just transitions in our world? Let me stop there and invite Tony back in to help moderate and have this as a lively discussion.
Cool. Thank you very much, Tanya. That's fascinating stuff there. Just a quick note for everyone. If you'd like to ask a question, raise a point, enter into some good-natured haggling over anything, please type your questions into the Q&A box here on Zoom. Just click on the big button at the bottom of your screen, type the question in, and then we'll get to it. Alternatively, if you'd like to come onto camera and engage with us, just raise your hand using the button at the bottom of your Zoom screen, click on that, and then we'll know you want to be drawn in, and then we'll invite you to switch your cameras on. So make sure your hair is looking okay, and you can join the discussion. While we get those questions in, there's a couple of things that leapt out of me, Tanya, during the course of your conversation, and of course, the Viagra examples are a good place to start. How often do we see in the world of science that a happy accident happens when scientists get into a lab or start a piece of research, go down a particular path, and then suddenly a discovery or an observation takes them off in a completely different direction? There must be other examples.
Tony, it's a fascinating question, and it ties back to sort of some of the pieces that I mentioned right at the end, which is what's holding science back. Often it's do scientists have the space to go off track and pursue something that is sort of not quite what they started off looking at, or are they straitjacketed into kind of the kind of having to have a blinkered approach that, even though this looks rather fascinating, I might save that for another grant application. I need to keep going off in this direction. And where we see interesting things having happened is where either R&D, labs, companies, or indeed resources make it possible for that sort of side journey, that detour to happen. And I'm holding up here, which something that I'm sure all of us have, if not right now, because I know some of you it's evening time, but on your desks, Post-it notes. And the story behind the Post-it note is exactly this, Tony. It's exactly the time that 3M, the manufacturing company, gives employees to spend a certain percentage of their time to just doodle, go off and explore those things, that are kind of really curious. But the Post-it note, specifically the piece that is this, like, you can stick it onto something and then take it off and stick it back there again, was actually a scientist who was working on what was going to be a better adhesive, a different adhesive, and what he ended up with was like an adhesive that wasn't adhering. He simply wanted it to be something that didn't have to take too much on it to stick. But the problem with this was it wasn't working, because you would stick it to something and then you could take it off again, and then you could stick it on something else, which was 180 degrees, not what he was looking for. But then, in fact, it turns out that's a brilliant idea, because none of us wants any one of our Post-it notes to kind of ever stick to where it is that we have originally stuck them for life. So, it's a great.
And I wonder how many potentially great discoveries are then discarded because the person who discovered them writes it off because it's not what they're looking for. So in the Post-it note example, that person could just as easily have said, oh, this is rubbish glue, and just kept going, and we never would have known the Post-it note. How many other discoveries, I suppose there's no way of knowing, have fallen by the wayside through that kind of single-minded obsession with a very particular result?
It's a great, and I could definitely confirm we will never know, or at least I have no idea.
There's a whole study.
I'd love to know someone.
Yeah, maybe there's a whole study to be done just on that. Things we don't know, we don't know.
Well, exactly, yes. But I would say, though, Tony, I would say that, part of it is also around kind of, and this science does have, is a real kind of community and a real focus on improving science communication. So not only among scientists in published peer-reviewed journals, but in really making the work and the process of science really accessible. And this is where the part that you're talking about, where you have maybe a piece of research and maybe you can't see the application of it, is how can you get that out and engage with more people? Because somebody might say, but that actually we could use this in a different way. How do you expose that? How do you kind of have that more co-creation? And this is really where the innovation components come in, user-centered design, having things where you don't always work, you're not working alone, where you have a community of people, where you really start to throw around ideas, and they definitely end up not where you may have thought they would have at the beginning.
And how often do we see major breakthroughs come about as a result of scientists from completely different disciplines encountering each other's work and embarking on a collaborative path that neither of them probably were interested in the first place? Because that must have, because scientists tend to start off, I would imagine, working down a very specific within their field of expertise. But there must be some great examples of work that's come to life because scientists have found each other. I mean, is there a science equivalent of Tinder where they can sort of go through and swipe right if they really like the research that someone else is doing?
I love that. I love that idea. I mean, I do think it's exactly that sort of, what are these kinds of communities? You know, there certainly is sort of the kind of, I'm sure scientists would say, the large conferences that we have is literally about doing that in person. It's sort of speed dating, but it's the speed dating of the mind. It's kind of this whole intellectual meeting. The question, though, is often these are quite focused. You know, it's the quantitative blah, 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 or the, you know, it's very, very focused on specific topics where you're going to get mostly the scientists who are doing the leading work or they're most interested in, or, you know, doing research that's related to that topic. And it's the same challenge that we have not only in science, but in business and in, you know, in the sort of multilateral development, is where things are siloed, but actually sometimes the beauty is in when you break through those and when you bring a different mind to a different problem, and you just really, you know, what could happen when you do that.
Yeah, and on a similar note, there's a question here from Janice Limson. Hi, Janice. She asks, what role can co-creation play in helping to develop products that communities both need and want? It's similar sort we've been talking about, but in terms of taking research to products, is there scope for co-development to take that further? And when scientists and academics are working in a product development space, is there some way that they can overcome that challenge to bring those things to market and to sort of maybe get them away from that single-minded thing that they are pursuing because it's being funded by a particular company or a particular grant or so on?
You know, and absolutely. So many great, like, I think, portions of a question in here. So definitely, I think, you know, from focusing on kind of almost our process at UNICEF, so, you know, 128 countries, where we also are trying to innovate and find different, you know, not necessarily always science coming out the lab, but certainly trying to bring together people who have different specialization to co-create. And often, you know, what we have learned from experience is that designing something for somebody because you know that's what they want, that's not always the recipe for success. And of course, I know that there will be people who believe firmly in the school of Henry Ford. If you ask people what they want, they would have told you a faster horse. So there is that. So there's sort of, I don't know, a beautiful point somewhere in the spectrum of don't design for people without engaging them. Plus also maybe, you know, they're not even going to see the application kind of that. You know, I guess we could ask ourselves if, you know, 30 years ago, someone would have asked you, would you like to walk around with your telephone in your pocket? You know, it'd probably been like, I mean, the thing is too large. What on earth are you talking about? Why would I want that? I don't need to talk to people. They can phone me and leave a message.
Yeah.
You know, or you can phone me until somebody answers the phone and writes down the message and tells me when I get there physically. You know, so I do think, I mean, personally and kind of professionally, 1000% behind co-creation. And also in terms of taking research into a product, that is that kind of user research, that sort of, there's so many refinements in terms of how does this work? Does it work? You know, I mean, this is not necessarily a scientific example, but the thing that is coming into my head was a number of years ago, I was in a particular country where we were looking at how effective have our instructions been on the use of condoms. And unfortunately, in that particular case, or not unfortunately, but you can imagine people were demonstrating how to use this. And in this case, in this particular part, we're using, this is a broom handle, and this is how you know, apply the condom. But the rates were not changing of sort of sexually transmitted infections. And that was in fact because people did not really understand fully that this was an analogy, right? Same thing, if I switch that, do our instructions work? And another example where we were sort of in a very cold climate, and we were testing whether people really understood how to use these new clean cook stoves, which are, it's the sort of bane of existence. Is everybody innovates the clean cook stove, but none of them really take off, and then none of them are used properly. Why is that the case? And in this case, people could not understand the little line drawings that had been tested in one market in Asia and exported off somewhere else, and nobody could figure out. And in fact, when people put these stoves together, the very device that was supposed to help control the rate of burning, that was completely explicable. So people threw it away. They thought it was an extra piece and just connected the rest of the chimney. So we did nothing other than, but there was nothing else that was done other than supply another kind of stove into the market that was definitely not as clean as it was intended. Those are great examples of not testing in the market with the actual people who are going to kind of, use your product. And I think the last part of Janice's question around, are there teams that you can pull together to sort of support? I think that Intel Research Labs has a fascinating model in the area of artificial intelligence. Because as Tony, you said, how do you get people who might compete to cooperate somewhat, or to at least kind of collaborate? And they've actually established an advanced artificial intelligence lab where they have themselves, they have Google, they have Meta, all working together on explorations, frontier explorations in artificial intelligence, which is something that they're all commercializing. So they've worked that out even in this highly kind of competitive environment.
I heard recently of another example, and I think it was possibly also from the Intel labs, which is, it goes to the point you were making about the pressure to publish, because the outcome of that is the sheer volume of the amount of work that is published every year is too much for anyone to get their head around, let alone read. And they're using artificial intelligence to read specifically research that's being done into cancer and oncology research, to try and use artificial intelligence to synthesize all of that information so that it's easier for scientists working wherever they are in the world to digest what is published on a daily basis, and also join the dots between often disparate studies that might be happening in different parts of the world, but that there are little threads within those studies that need to be joined together. In the absence of all of us having a sort of artificial intelligence brain on our desks, though, how do researchers ever hope to try and stay on top of the latest from their fields? Because there's a lot of reading, and why would you read all that when you've got all these true crime podcasts to listen to?
So now we know what you're doing on your drive home, Tony. But no, I think information overload, which was a term coined a few decades ago, has only become worse. I think practically, it is impossible to yourself kind of primarily do that. I think it is almost though that we are going to each have our artificial intelligence agents, assistants, whatever, programmed out. I mean, and you probably, all of you already have one. I mean, do you have you signed up for a news alert? Have you customized a newsletter? Have you, and obviously some of the media tries to do that in advance by looking at your viewing habits and trying to survey up things, which is really dangerous. That all these things that help us where we are narrowing our scope in order to make information intake manageable, also means that we're missing out on exactly what you said, that the serendipity. And I think there's definitely more research to be done in the value of serendipity, but I do think though that the kind of aggregation, you see the popularity of read 100 books a week, because we'll read it for you and give you the 5-second praise, 5-minute, 5-sentence précis, because you can't read all the business books, or whatever that may be.
Yeah. There's a question here from Kim Wadelov, and the question she's raising is a little bit about the pressure from funders and employers and the pressure that they bring to bear on researchers to publish. Because she's a little bit cynical when looking at scientists' CVs, all they seem to care about is publications, presentations, and awards. How can we encourage young emerging scientists to be science that stays in the lab? Given that there's this pressure, and I would imagine whether you're working for an academic institution or for a corporate, there is that pressure on you. So how do we crack through that, particularly for young scientists?
Absolutely. I mean, I think there's a couple of aspects to an excellent question from Kim. One is we have to acknowledge the kind of warts and all reality of what we sit with, which is the incentives in science are absolutely what she characterized. If we stereotype it, yes, you know, the longer and more prestigious the publication, that's definitely a peer-reviewed kind of benchmark journal, the better. There's definitely there is an existing kind of culture and value, and therefore a disincentive to, you know, to if your work is not producing that or not enough of, or compared to others, that is unfortunate. That is the kind of existing sort of model that is not always incentivizing this work. However, I think the changes that we've sort of seen in so many of these examples of how things, you know, many very successful, and in that case, I mean, commercialized solutions are about it did not end, or it did not lead to, or it was not supposed to only be a publication, but the things that really sort of move things out of a purely academic sphere are where things can be, you know, applied. And so you know, I think in the academic sphere, it's going to be difficult to imagine how in an institution that does not have a value on technology transfer as a measure, right? Because that would be science that can go somewhere and can be transferred, commercialized, spun off as a company, etc., where there is a absolutely much higher value on that as well. It would be, you know, it is going to be more valued in terms of publishing. In the kind of private sector space, it is going to be research that drives, you know, a market need that can be commercialized. So you could always look at that. That's equally stifling. What if you have something you're so curious and passionate about, but, you know, it's not going to generate enough money? And I would say, throwing out a challenge that we at UNICEF have had, and, you know, anyone working in the space, is people do not want to put any money into researching formulations for children of any kind of medicine. Why? You know, because you can just chop up the pill, you know, just give them a quarter. It's not like who's got, you know, most of the medications we're talking about are going to markets that they're not going to pay enough for. So as a result, you really don't have these great pediatric formulations. That's a piece of science that would be meaningful. But in terms of commercializable, it doesn't make commercial sense if that is, you know, what an organization is focused on.
And a lot of the work that you do is in the space of seeking out the breakthroughs that have a very real tangible, make a very real tangible difference to the lives of so many people. I mentioned at the top of this talk the study from UNESCO from 2021, which indicated that so much of the growth in spending in research is coming from the US and China. Which seems to imply that the developing world perhaps isn't investing as much in scientific research, and fair enough, there's probably other priorities for their spending. But given that the kind of solutions you're seeking out are probably most beneficial to people in the developing world, how do you get the developing world to take science more seriously so that they can begin to invest, maybe not at the same sort of levels as the more established economies, but certainly in a way that can directly help them find results for work that is going to benefit their own countries and their own communities?
Yeah, absolutely. And I do think, you know, there's so many elements to that. I would say that, you know, for those who are with us today, who find themselves doing research in South Africa, there is a real benefit there, because it's not only about how much money there is, but also, as you say, the government infrastructure, you know, the interest in, for example, departments of trade and industry, departments of science, innovation, and technology. Do they even exist? Do they have a structure that helps you? And I see Wayne has a question about intellectual property. Do you even have that? Is there a legal system that helps to move things through a commercialization process? We know, you know, historically, there have been examples of things where great ideas, or, you know, also indigenous solutions, have been patented by people in countries that are not the countries they come from, simply because there's no opportunity, no legal instrument that existed at the time to protect those. You know, and that's really incredibly unfortunate. So it's not only the money, it's the kind of policy. Is this important? Do I even see it? Because the money follows all of that. Then do I have an architecture to do so? And across, you know, Africa, it is quite variable. You have a couple of countries that do have this, and then for the most part not. And it is absolutely, as you say, Tony, there are other priorities, because if I'm sort of sitting thinking, should I be investing in basic and, you know, research? And when I say basic research, this does not mean simple research. It's fundamental research, you know, the basis of science, or in my educational health systems, and the result of COVID, by the way, has been to strip out resources from every other thing, to really address the harsh impact of that. So, you are balancing almost impossible choices. And then I would throw back and say, I think that governments in developing countries around the world, the things that they can do, the things that maybe don't cost so much all the time, and that's invest in policy, invest in infrastructure, invest in processes that kind of can enable this, that invites then other people's money into that market. So it's not necessarily always, the domestic or the national kind of treasury that has to cough up. But if you have a context where people do not, or investors do not believe that, they're going to fund something because who knows what's going to happen to it, because there's this fuzzy world out there that we don't know what we would be able to do, even if it was a promising outcome. I think that is sort of a wise investment that enables other things to happen.
Yeah. Okay, I have one more question, but just for everyone watching, we're just about to run out of time. But if there are any quick, we can probably take one more question in the Q&A box. So fastest finger first, whoever gets the question in first, we'll take that one. Just while we wait to see if there are any more questions that come in, just a question, and you mentioned how a lot of other research stopped as COVID broke, and as obviously that's where everyone's priority shifted. Do you think the COVID pandemic has set back or enhanced research going forward? On the one hand, we've got some great vaccines out of it, which potentially could be used for other diseases as well going forward, and there's a lot that's been learned from that. But on the other hand, as you say, a lot of other research has taken the back seat. Can that be recovered from quickly? How much is, if at all, has COVID set back research in the world?
Actually, so I'd say this is interesting. I think it's done both of those things in different ways. So I think, so I would say one thing is, it's not necessarily that research that was underway came to a grinding halt. It may be, though, that funding that may have gone to other kinds of research or even other kinds of services just didn't ever go there, and may not for years. So I think in terms of that setback, it's a setback to everything, not only scientific research, but also scientific research. I think the positive impacts that we've seen is it's really, demonstrated to people like science, research, actually commercialize it into my life. That happens. It's not it's a thing that happened, and so many millions of people will benefit from it. There is, as I said, although the mRNA research had been done for quite many years, the commitment to actually applying it so rapidly to produce not only these vaccines at number and the entire kind of supply chain, which is very complicated for these vaccines, which have to be sort of kept at low temperature, that has happened at absolutely breakneck speed. So we also can't then hide behind, or the world or people cannot hide behind the fact that they would then say, oh, it's not possible, because we've all seen now it is possible. Yeah. So, the impossible has become possible in a very public way. And I think it will also provide more of a precedent to push for other things, because then there are, of course, other questions about exactly what you said. We have an mRNA technology that allows us to understand COVID variant, X and then Y, or completely different disease. You can actually do that as long as you've done the complete sequencing. So are we going to do that? And why would we not do it for some other things? And if, there are a number of so-called sort of marginal diseases that really haven't had this attention, will we see that? I think it allows us to be empowered to ask questions with evidence that we haven't a lot in the past.
Do you think, I know I said that was the last question, but this is slightly related. Do we think that because we know that we can get a vaccine out so quickly for something like COVID, do you think it has shortened the research cycle of a whole bunch of other kinds of research that might be required in the future? Do you think we're going to see vaccines come to market, or medications or treatments come to the market much sooner now as a result of the COVID learning?
That's interesting, because I think these things are not all necessarily the same, and they will always be at the heart of bringing things to market, making sure that we test them, we have tested them sufficiently to make sure that they aren't doing any harm. And actually, I'm sort of seeing in the medical diagnostics space, so not the vaccine, but almost like, the many rapid tests and things, we're actually seeing actually more of a process applied to that, because the kind of processes required to be able to push a diagnostic out to the market are going to be increased. So there was a relatively low barrier, but unfortunately, because there were quite a few sort of junky or, you know, largely inaccurate, you might as well have just kind of flipped a coin and said whether you were positive or not. Products that got out there, it has gotten sort of the attention of regulators that medical diagnostics like that really need to be better regulated. So in fact, I think we're going to see a slowdown, because we'll see more regulatory processes for some things than existed before COVID. It's for a good reason, but, you know, but I think the other push, though, that we can rely on is really the value of the rapidity of responding to things, because we could also sit back and say, well, let's take another 5 years and we can all just imagine or speculate on what the results, practical, you know, life and death results of that would have been as well. Yeah.
Okay. I think we'll leave it there. We're out of time, but Tanya, thank you so much for talking to us and for leading this webinar. Some fascinating thoughts and insights there. Enjoy New York. Thank you very much for joining us.
Thank you, Tony, to you and Freddie Braden and SciFest Africa. A fantastic opportunity, and then really one of those opportunities to bring people who are really interested, fascinated, curious around science and what it means in our lives together. And thank you for the chance to join you all.
Great, and thank you to all the participants for joining us. Keep close to the SciFest Africa Facebook page, which is where I believe you'll be able to read more about future seminars and webinars, and of course the big SciFest Africa event that's taking place later this year. Thank you all, and have a good evening.